Doctor, how much pain relief do you achieve when using lateral buttress patella bracing or taping? Years ago, Jim Weber asked a very good question to a great customer of ours, Dr. Clarence Shields, at why he was using so many different kinds of patella braces in his practice. His answer was simple and surprising. None of them work for all patients. Dr. Shields wanted a brace to mimic the effects of taping on a patella. John Hely had done that earlier when patenting the ASO ankle brace, so he put his efforts to this end and developed the Shields brace along with Jim and Dr. Shields. The Shields brace is made from a cool perforated neoprene base. That cool neoprene provides compression and warmth to the patient but allows 80% of the water vapor to dissipate. The back panel is a suede lycra, which provides excellent comfort in the popliteal area of the knee. The exterior of the material is constructed with a unbroken loop material called OK cloth. It is made in Japan and it is known as the best quality unbroken loop material, meaning that it has the most Velcro cycles of any product available. It's quality through and through. The brace is an anterior closed brace. You can fit the calf and the thigh independently for a close fit. The calf strap wraps above the gastrocs, so slippage is less of a concern. This helps the brace fit a myriad of size and shape patients that you see and eliminates 50% of the inventory because it can be used for both right and left knees. The heart of the Shields brace is the U-shaped tracheoderm buttress. This is not just a lateral buttress as every other brace offers, but a floating U-shaped buttress that's made of a material that has an inherent quality to it that is sticky, and that stickiness will dissipate over time with oils, skin, and hair on it. All we have to do is wipe it with an alcohol swab or clean, warm, soapy water, and that inherent quality comes right back to it. That inherent quality can grab the patella and allow us to move it in the position that we want to move it. So the patella and the hand moves the patella into position, and that position is held by our two dynamic force straps. Once the patella has been positioned, the two dynamic force straps can apply force to the patella. If the patella is Baja, we can pull it up with a Baja force. If the patella is Alta, we can actually pull it down with a downward tight force. Rotation and tilt can also be addressed. Simply taking the leading edge of that buttress and running it over top of the patella and holding it there, we can address anterior-posterior tilt. And by adjusting the tensioning of the straps, we can accommodate rotation of the patella as well. The goal is to dynamically position and hold the patella with full contact right in the trochlear groove, where it is most pain-free for the patient. The special part of the Shields brace is that it can be fine-tuned in its adjustability. It's not a fixed lateral buttress that prevents the patella from sliding out, but a dynamic force to the patella that can be adjusted. Who knows where the patient is most pain-free? Well, of course, the patient does. It's almost intuitive for the patient to adjust the tensioning on the patella to find the most pain-free position. That's why the brace is superior to taping, in that an incorrect force on tape cannot be corrected without removal and reapplication. But with the Shields brace, fine-tuning, a little more tautness or a little less tautness in the straps allows us to find that most pain-free position of the patella. What's very special about the Shields brace is that it adapts to the care of the patient. The brace removes pain, but therapy is the answer for the correction. As the patient strengthens, pain often migrates, and the brace can be modified to treat that migrating pain. The Shields brace isn't just a one-trick lateral buttress pony, but a brace that can be modified and adapted to the care of the patient. Dr. Shields said to us that just millimeters of movement are necessary for this pain relief, and that 80% plus pain relief is achievable. If this is the case, less pain means more complete exercising and effective therapy. That's what hundreds and thousands of patients have experienced. Doctor, what are your thoughts as to how the Shields brace can work in collaboration with your therapist to provide pain relief to your patients?